binocular microscope. If you can see with your specs, if you are in the habit of seeing with your specs, you see it. Not like this, like a pirate, you put out this thing. You just see like this with both eyes open and view, and these things, a binocular microscope, the stage is there. Now it goes up and down the stage. It goes forward, anteriorly, posteriorly. Now these techniques you have to develop, because amongst you, no one can say that you become a super pathologist. So you have to handle things, you have to handle your gadgets accordingly. If anyone breaks a slide, he has to pay for it, because we have few slides, we have two, few slides, we have one, and it is very difficult to procure or get a slide. Whatever thing is that, last day I told you khata, that's finished, that talk is finished. Okay, I'm not repeating. Now, what you have to do in this break, by coming week, you draw the microscope and how you process a tissue and the histological technique, or H&E stain and all this methodology. You 3 pages, and then epithelium and lymphoid tissue on the next. One thing what you have to do is that you have to get it signed early. Usko आपद विपद, तो आपद सोच के पहले कर लो, otherwise you will fall in विपद, you will fall in a problem, because रात जगह जगह ये करबे, don't. Every day 36 slides, 30 days a month, you are having 2 classes, so 2 classes histology, 2 batches, 1 class in histology. So you accordingly draw and finish it within Durga Puja. What I'm saying, what you will do, because see you draw the things earlier. You will be reading and seeing the histology book, and then you finish your khata. And as it is, you can change the pages, so it's ready. Now when you come to the class, you see, view, you are having a knowledge over there, you get it signed. Your alap or that Anushan, Novin Baran, freshers welcome, it will be in a bit late, means whatever, when all the students come. Naturally, by that time, you finish your histology. If not that, you take another this thing. Now why I'm telling you, it gets, before exam 7 days, who will sign, sir, so I didn't think it. Though I have been telling to the last 4 batches, only few students worked out regularly. Don't be in the lagging behind. Okay. Now you see, now these are the things will be competency-based undergraduate curriculum. Now you see, I have to identify lymphoid tissue under the microscope, describe microanatomy of the lymph node, spleen, thymus, tonsils, and correlate its structures with function. Now histology, see, is carrying around 15 marks, 15 or 20. One will be theory, it can be in MCQ, and this is nothing to note, I'm just telling you. Now you, this thing, identifying the slides, exam, spotting. Okay, you will be given 5 slides. You see, cling, and go to the next. This is system. Now over there, when you are drawing in your, you need not draw, Spotting, you identify it's a kidney or a spleen or a what type of tissue it might be. You have a time, you won't, you just identify and give one or two just specific identical structures which pertaining to that slide. Am I clear? Now you just write, like you say kidney, your spleen. Spleen is cortex medulla, red pulp, white pulp, red pulp, white pulp. Plus then you go to another slide. Kidney. It is the glomerulus that is identify. You can identify the kidney from other organs. So you say glomerulus. Now you identify, you write glomerulus. Kidney, 1 point, glomerulus, or 2 points extra, whatever it is, the Bowman's capsule. Bowman's capsule. Then you go to the next slide. Now, if you can score 10 marks, solid, you might be having a shortage in your theory. Then you walk through. That 10 marks will be added. ये तो histology वो बेकार की काम है, क्या देखेगा? Don't do it. After I demonstrate, you spend some time in the this thing department. After viewing, you come and see your histology textbook, and that will be fresh in mind. Go home. Any day you have spare time, no, you have to take out the some time. I won't say spare or this thing. These words I am not using, because you have to give that khata in time. So day to day work, you draw the line. Now epithelium, simple epithelium, columnar epithelium, pivotal epithelium, stratified epithelium. Like this, you go on drawing pictures, and you just not simply drawing pictures, because see, one thing happens, whatever. Now I'm telling you that these are the things. Oh, microscope আমি দেখছি, ধরো টিচার চলে গেল, আমার টিকিটে ধরে টেনে দিল। হ্যাঁ, এগুলো চলে, এগুলো করতে হবে, কিন্তু তার মানে নয় যে you will waste your time. Because one thing I tell you, this is 1 year's course. Out of that, I would say 3 months. তোমরা কবে ভর্তি হয়েছো? 1 মাস হয়ে গেল তো প্রায়। হ্যাঁ, তাহলে চলো দেখো কিভাবে গাড়ি চলছে। এখন 2 মাস আছে, তারপরে পরীক্ষা দিতে হবে। First semester exam. Every component will be there. Histology will be there, your long questions, short questions, everything. So you do and enjoy on weekends, whatever it is, but every alternate day you want, you are craving for some kebab, you are craving for some roll or something, take a toto, some sweets, you make it a fixed time. No, this you have to time manage. We had 2 years, anatomy, physiology, biochemistry, and your nothing changed. In biochemistry, what is the glucose, what is the blood sugar, what is this? This is not changed. So it will be questioned. Of course, in detail we don't ask. Like skull bone, you do the base of the skull. Why ফুটো দিয়ে কোন দিক দিয়ে যাচ্ছে? What is going? This what? Only major structures, major things are asked for. In detail, it is not there. It is completely cut off. But you are having 8 months or 9 months. 9 months after 3 years, 1 month, or either udar, and don't try to leave your this thing for any train. You're asking your, don't tell your parents that you are bit having a headache or this, or your food is so bad and all this. Don't. This food is, when you will pass out as a doctor, you won't be getting any food any day. You won't have any time. You go for an operation, you come out after 6 hours, lunch gone, evening tea is gone. This is reality. So you have to, now the clock you have to reset. You have to reset your clock. Now next thing, now what we'll see today is a structure of the your lymph node and whatever they are giving. Let's see. Now these are the pictures. Your lymph node, spleen, thymus, tonsil, and correlate its function. Now what is the function of lymphoid system? The immunity and this thing you have to read it yourself. I'll show you the thing. Now, system provides protection to individuals by imparting immunity. You know this today, but when you go home, you just read what is innate immunity, what is your native immunity, acquired or adaptive immunity. Okay. Now, see what is acquired immunity is two types. Can be asked as a short question, not always viva. Viva, it won't be asked so much, but because you are having spotting, and that slide won't be discussed with the examiner. But you have to do in your theory that because it might be in a short question 4 marks. Get it clear? Now you just know this type of this thing. Every book is same. Indervir Singh or whatever, Vishram Singh, Prabhat Singh. My name. If I write some book, I will say Prabhat Singh. So whatever it is, you see, you make it like this. And whenever you go to the histology lab, you have your khata. Don't have a very beautiful notebook. You can write poetry in that. You can write songs in that. You can write very good letters in that. But you have to have your textbook, textbook in histology, keep it inside, and then you carry on. You view with your two eyes, not when you are viewing your two eyes, you see it is adjustable, According to the thing, your vision, you adjust. This adjust to my vision is complete. Now what you do, the examination hall, you have to just adjust the fine adjustment. Because if you require, otherwise the thing microscope is set, you don't touch any other thing like the stage microscope or stage this thing. Then you see you go forward, and in the examination hall don't touch. It will be fixed by the our professors or whoever is there. He will just fix it in that so you can understand. Now you see like this. You put your hands like this to rest, and because a single movement or single operating the optics, hand drawn picture, spleen as seen in the drawing, see drawing. This is the hand drawn, the histology textbook, the khata, you won't, it's no, you draw a small piece like this size, and you just draw to this thing, and to some extent, but don't do a very artistic drawing. But you have to put a legend. Legend means what is this slide? Photo, figure 1. You say that it is this slide, the spleen or kidney or something like that. Photomicrograph. Now see the photomicrograph. This is a, if I take a picture with a photomicrography setup, camera and setup, and then click, then this type of picture will come. This is a hand drawn, this is the thing. Now in the class, when you're coming for your observation of slides and all, you just have this like this, and these are pulp arteries like that. Okay. Similarly, you take out lymph node. Admit. Histology textbook you must carry. Now you see this, and you take out one of your books and see lymph node. Now this is the lymph node. Now 2 lymph nodes I'm just saying. Now what see this? Now lymph node you can see like this. These are all connective tissue. You can see the blood vessels. This is the medullary sinus. Now you label, okay. As you see, you compare and label. Okay. Now now this is the lymphatic nodule. This is the germinal center. This is the medullary sinus. বোঝা গেল? আর এইগুলো সব vessels আছে, এইগুলো vessels আছে. Now you just see এটা করো, এই দেখো, এটা যদি ইয়েতে দেখতে হয়, এই দেখো, এটা দেখো, হ্যাঁ দেখো, এক এক করে দেখে নাও. Stain. These are special stain, red and white pulp of the spleen staining Mallory Azan. And that is HNE stain. So you will be given HNE stains, like, but the picture is the connective tissue, the connective trabeculae, and the red pulp. 4 is the red pulp, is the white pulp. This is the white pulp, lymphatic nodule, germinal center, central artery, and red pulp, venous sinuses and splenic cords. So down the years, I thought that I'll be presenting like this. There was no specific books in histology for us. What I did, first museum I decorated or whatever it is, I built up, I would say, Bardwan Medical College. That time I took a book of D. Fayer's histology textbook. Those 2 volumes I bought and cut and framed like this. So this is not D. Fayer's, this is whatever it is. You see most of the things that's pertaining to your syllabus, it is here. But bring your textbook, you see for yourself, because we'll demonstrate at least 50 students we cannot show individually. But if you have any query, you can see it, I'm there, or any other teacher is there. That 15 marks is not a matter of joke. Done well in theory, 10 marks that failed in practical. He has to give the whole exam. I am focusing on 60%. Pass out. তারপরে তুমি you become an anatomist if you are a fool like me, or whatever it is. No, I'm just a joke, I'm cracking. Anyway, whatever it is, you learn the basic technique, how to handle your study. Basic technique, because see, it is a tremendous thing, big syllabus. And you don't leave it for the, abhi to exam bahut deri hai. Don't do it. Because as far as we had a panic. Every day we were panicky, whatever it is. But today's students, I would say, let us have a frank chat that everyone is very casual. Don't mix up with English language, don't mix up with computer science or anything. With medicine, don't. It cannot be bashed with any subject in the world. But you have to conquer. We are done. Your dadas are still doing. The CR of the first batch, Shayan Goswami, He was in a first 1 month or 15 days, he was disgusted. He was tried to say. I had many chats with him over phone. No, then I told you have to get a gold medal. He got a gold medal. Now he's series of gold medals he's getting. So nothing is impossible. The person who tried to leave, now he's in track. Like a man-eater tiger. Once he tastes the human blood, then he goes and try to bite a person or kill a person. It is like that. So don't always carry your book.